Louise Baggett. I'm a UNR graduate clinician at the Speech and Hearing Clinic, and today I'm going to be demonstrating the CAMP voice facilitating technique, which you would use with pediatric patients, typically those who are at risk for functional voice disorders or who already have one. If they have a big event coming up, like going to camp, or a big vacation, or a slumber party, or even just around school. The idea behind this technique is to raise awareness of what the loud spaces are and the quiet spaces. So we have Yessie here today, who's going to be playing our client, and I will demonstrate that technique now. So thank you so much, Yessie, for bringing a picture of your school that you brought in. So you have a lot of fun places on there. Can you tell me about them?
My favorite, the playground.
Okay.
And then my second favorite, the cafeteria. I love to eat lunch. And then the library and my classroom and the office and the flagpole.
Wow, you have a lot of places around your school. Can you tell me some of the places where maybe you do singing or you're louder when you're talking?
A playground.
A playground, that is a good one. So I think your picture is a little empty. It doesn't have any colors on it. So I think we should color it. What color do you want to pick that's going to represent or be our loud color?
Red.
Red. Okay, so red is loud. Can you color on the map where the loud places are? Coloring the slide. That's definitely a loud place.
Mm-hmm.
And the swings. And the teeter-totter, okay. Are there any other loud places?
Mm-hmm. And sometimes in my class.
Sometimes in your class. Okay, so those are all our loud places. Now I want you to point on the map. Where are the places we use quiet voices? What place is that?
Library.
The library. So what color do we want to be our quiet color?
Yellow.
Yellow. Okay, is there any other quiet places?
Office. You get in trouble if you talk loud in the office.
Trouble.
I don't like to get in trouble.
No, we don't like to get in trouble. Now, I want you to tell me, where are some places that we have the in-between voice? It's our normal voice.
Sometimes in the classroom.
Okay.
Or when we're walking around.
Walking around. Well, what color do we want our normal voice to be?
Blue.
Blue. Nice job. All right, Yessie, can you tell me about your colors on your map and what they mean?
So red is where we're loud.
Okay.
And yellow is where we're quiet.
Mm-hmm.
And then blue is medium.
It's medium, in the middle. Right. So when we're in our loud places, we have to be careful not to hurt our voice. So when you're being loud, we don't want you to be too loud, right? That can hurt your ears. It can hurt your voice. So when you're being loud outside, if I'm trying to talk to you and I'm all the way over here, where do you think you should be that makes it easier for me to hear?
Close to you.
Close to you. So in our red places, we can try to be closer to our friends so we don't have to be as loud, right?
Mm-hmm.
Okay, Miss Yessie, you get to take this home, and I want you to put it right on your refrigerator, and you can explain to Mom what we colored today, okay?
Okay.
Thank you.
Thank you.
So, as I said earlier in the video, the point of the CAMP voice vocal technique is to be able to help pediatric clients identify the different types of intensities that we use when we're talking. And typically, when you go to camp or you go up to a summer camp in general, there's a lot of different areas in those camps that they use a variety of different voices, right? If they're in the mess hall or the cafeteria, they might be singing songs with their groups or their tables. They might be yelling, they might be chanting. At the flagpole, maybe they're being loud, so they get to go eat first. That would be a loud noise area. Whereas you may have the bunkhouses or a quiet space designated at camp where they're going to use their quiet voices. And the idea is to let a child be able to recognize on their own the continuum, right, that high and low of our intensities and where they're used. If they're able to identify, oh, the cafeteria is a loud noise space, they know and expect that they're probably going to be using their voices in a more intense way. So if they are either at risk for a functional voice disorder or they already have one, we don't want them to use it in a way that's misusing their voice and then later having them have secondary characteristics because of the misuse, which could be a potential problem that we don't want to even get to. So if we can get them to identify those spaces early enough, we can then teach them techniques when they go into the loud noise areas that they can use in order to keep good vocal hygiene. In terms of the various ways that you could apply this in a therapy setting itself, you could definitely go for the measure of creating a SMART goal, and you would just share that with that patient. And depending on, their age level, that's how you're going to word it to them. You have to practice that code switching. But an example of a SMART goal that you could create with the voice camp technique would be: patient will demonstrate an awareness of the variety of vocal intensities used across different locations in their environment by describing or identifying on a visual map the loud areas, the normal medium areas, and the quiet areas for different environmental contexts, such as school, like how I used in the video, a campground, or even their own neighborhood, with 90% accuracy within 2 weeks. It's been shown that kids definitely are a lot more observant than we think they are. So, you could adjust those lengths of how long you're targeting this goal based on individual client need. When you have the client have their map of whatever area you're targeting, you're going to ask the child to make that map themselves. So they're going to draw it beforehand in pencil or pen, and then they're going to bring it to your session. So the map that we used was a school map, the areas around our child's campus. And when they brought it into therapy, it was no color on it. And the idea behind it is you're going to have the child identify those spaces and choose those various colors, not the client or the clinician, excuse me. So when you ask the client to bring their map out, you're going to pay attention to the areas that they drew and ask them thought-provoking questions that will help them connect what types of voice activities we do in those areas. So for example, you could ask, where may you be singing more? Where may you be yelling? Have them identify on the map where those areas are. You want to see what they know. And then you can ask, well, where are there other loud areas? Giving that label to it. Once they've identified those loud spaces, you can have them choose a color that represents the loud space. You do not choose it, the client does. So for example, in my demonstration of this technique, our child chose red to demonstrate the loud spaces, which is pretty common. And then our child continued to our next type, and that was yellow, which indicated the quiet spaces. And then finally, our child indicated blue areas or blue spaces to represent those normal medium ranges of intensity. So you'll go through those and they'll choose those colors and then review with them what colors they did choose. In terms of carrying this forward, this can serve as a great visual reminder for them. They can have posted by their bed, they can have posted at their house, so it allows them to constantly get a reminder of what those spaces are, and they're seeing it over and over again for generalization of the concept. From this technique, you're able to target a variety of things, whether it's just purely awareness or even if it's allowing them to learn how to modify their loudness in different spaces. This technique I found in the Exercises for Voice Therapy book written by Allison Berman and John Haskell, and this technique itself was introduced or wrote about by Leah Ross Kugler if you want to get more information on that. Thank you.